to kind of get this first opportunity together to meet the Treasure Valley or Greater Southwest Idaho, or let's just say Greater Idaho Physician Wellness Champions. You guys have been leaders for me at Ada County Medical Society, and I've maybe been a little bit of a leader for you, but we know that just as we lead each other, that there's so much vitality that comes from just coming together. And that's certainly what we found when we were starting the Physician Vitality Program 6 years ago almost. And just the coming together and working on a project on a core issue that's so meaningful to all of us brings a lot of synergy and dynamism and energy to each of us in the work that we're doing individually wherever we're at. So we're hoping that this will be more of the same, and when it ceases to become that, then we'll stop, because we don't have to keep things going that don't have life in them, right? So if I sound a little foggy or anything like that, I just rolled into Boise from Southern Washington. My mom passed earlier this week.
Oh, I'm so sorry.
Yeah, so thank you. And family is doing well, and of course coping as you would expect them to cope. So if I tear up more than usual, which is actually pretty often, then that's the reason. And if I seem muddle-headed, or if my computer is so slow, I turn it on for the first time in a week, and like so many updates. So, you know, these things like, come on. So that's how I'm feeling right now. So if I feel a little cloudy, that's probably why. But I hurried back here to Boise because I wanted to be with you guys, and also because tomorrow on the National Coalition for Physician Wellbeing, actually I'll be hosting that. That's a monthly webinar. It's free, and Dr. Colin West from Mayo Clinic is going to be talking about the National Charter on Physician Wellbeing, and I'm super excited about that. That's at 10 o'clock tomorrow, and we'll put a link in if you want to join that. It's a fantastic conversation that we're going to have all year long, and bring topics in around the Charter's framework, which I'll be introducing a little bit later on. But with that, I want to go ahead and go around the room and ask everybody to introduce themselves. I think I know all of you except maybe a couple, but I'm the director here at ACMS. I've been here since 2014, and physician vitality has become a core topic of concern for us, and we've been working on it hard and really providing a place of connection for physicians and others who want to be involved with that. So with that, I am going to have Jennifer, my assistant, introduce herself, tell a little bit about what she does here, and then we'll go through the list starting with Amy Baruch. Okay, so Jennifer.
Hi everyone, I'm Jennifer. I'm Steve's sidekick. You probably see me around if you come to any of our events. And I also work half-time with the IMA. So.
All right, Amy, take it away.
Great. Hey, Steve. So big heart to you. And I can't think of a better place than to be surrounded by people who love you so dearly. So thank you for making the time for us during this time. I really appreciate it.
You bet.
Yeah. So Steve has really been an essential person in terms of my participation in wellness. I think I'm Amy Baruch. I work as an ER doc at St. Luke's through all the facilities in Treasure Valley and out in Mountain Home, as well as in Fruitland. I think everybody's journey kind of starts with themselves. I think it has to start there, right, before you can help other people. And for me, it was sort of mid-career, realizing that something essential was missing from my education. And that's when I went and did a fellowship in integrative medicine at University of Arizona. And it kind of, I think I got a lot more than I bargained for, and really appreciate not just the education and insight, but I think it just was transformative for me as a person, but also as a physician. I'm really grateful for that education and the people that kind of had a similar kind of outlook than I did. It made me feel less alone in my thoughts about what was missing in medicine. But as a result of that, I ended up getting involved in the wellness committee at St. Luke's. And then I met Steve as a result of attending the wellness committee, and then he got me involved in ACMS. So I feel like it's just been this incredible evolution, just natural. There's been, I don't even think I knew where things were going to go, but they kind of landed me in some pretty wonderful places and meeting some really wonderful people. My current participation is through ACMS and then peer-to-peer at St. Luke's, which I found incredibly valuable and really enjoyed being a part of that. So that's where I am.
Very good. Thanks, Amy. All right, Abalash.
I think it's Andrew, right? Are we going alphabetically or?
I don't know why you didn't show up earlier, but Abalash is AB, so you should have gone first, actually.
Yeah,
Go ahead, Andrew.
well, sure. I'm Andrew Barron. I'm a family doc. I'm the CMO over at Terry Riley. Physician and prescriber well-being is one of my passions. And it really started when I took a 1-week course in mind-body medicine. Kind of opened up a whole new world for me, and made me realize I was not doing what I should be doing with my own life. So I've been on that journey since then, and I'm very passionate about this. I'm a champion in my organization, and I will be, I think, for the rest of my life when I'm in any kind of professional practice. And I'm just really excited that we have a group like this that's interested in figuring out how to help our colleagues just be healthier overall, and really be able to grasp the necessity of not putting work first.
Very good. All right,
Thanks.
let's flip back up to Abalash.
All right. So Abhilash Desai, I'm a local psychiatrist. I have my own private practice in the dementia long-term care world. Then I work for the state for autism, intellectual disability, and so I also do some wellness programs at State Hospital South with my physician colleagues and other colleagues. I teach VA psychiatry residents, so I've done some meditation groups with them. And I'm also part of St. Alphonsus Geriatric Clinic, and we've done some of this together. My burnout was like a long time ago, and then a nurse practitioner introduced me to Pema Chodron, and rest is history. So I have been fixed, I've been cured, I have drunk the Kool-Aid, so on. And it really helps me. And again, it's great to be part of Ada County Medical Society Physician Vitality Program. It's, I feel, top notch, thanks to Steve. And Deb and I have been doing our meditation group. We call it M&Ms, mindfulness and meditation, every 2 weeks. We love it. We benefit as much, if not more, from our colleagues and our interactions. And I knew so many of you by name, so it's great to connect by face. This is fantastic. Thank you.
And I'll point out that Dr. Desai is also our volunteer medical director for the Physician Vitality Program. So any questions that need to come up about that can also be directed to him in my absence. All right, Deb Roman.
Hi, everyone. Well, I think I've worked with a lot of you, which is so wonderful. It's so wonderful to see all of you over the years. We've done things together. Physician well-being and medical school student well-being is something I'm very concerned about, and have worked with Steve on, and I've worked with Molly, and I've worked with Amy, and pretty much all of you, it seems. There's a few people here I don't know. I've been involved in putting together conferences and workshops, and facilitating some discussion groups for physicians and for students. And I just feel like it's such an important piece that we're working on in our community. And we have such an engaged community, which is so inspiring to me. Ed and I have worked on putting together a physician well-being action collaborative to start addressing particular issues. We're working on prior authorization right now. and issues that are causing a lot of distress for physicians. And we've also put together a community-based group that we call Compassionate Communities, where we're trying to bring together the entire community to start looking at some of these health issues. So yeah, it's really a wonderful thing to be able to work. I think, as Abhilash said, we work together on a discussion group for meditation. I just feel very honored because we're in such an engaged community, and we're able to accomplish so many wonderful things for our small community. So I feel really inspired by our group. So glad to be here. Glad to see all these faces.
Very good. Thank you. All right, India King.
I think I might be the relative newcomer to this group. So
Welcome.
I know some of you, but I'm India King. I'm a clinical psychologist, and I guess kind of have joined this group by way of my role at the family medicine residency in Nampa. So I'm the behavioral scientist faculty there, care about physician well-being. I would actually say I care about healthcare well-being, but I do have a particular role with our residents out in Nampa, along with Robbie, who has joined, Robbie Crouch. We're kind of chair of wellness for our residency program. So look forward to learning more from all of you.
Very good. All right, Janae Cron.
Hi, everyone. I'm Janae Cron. I am a family medicine physician at the Family Medicine Residency of Idaho in Boise. And I found my way on our resident wellness committee, along with Molly McCormick. We were kind of co-leads when we were residents. And then afterwards, staying on as faculty, I am kind of a co-lead faculty representative with Sandy Mudge, where mostly our kind of focus has been on wellness, particularly to our residents, and just that unique period of training. And then by way, end up working a lot with Molly as she's kind of done some more kind of wellness focused stuff as far as our faculty members, and Susan Martin as well, all of us. So that's kind of where I plan on this.
Very good. Thanks, Janae. Katie Schneider.
Oh gosh, hi everyone. I was not paying attention to the alphabetical order. I'm Katie Schneider. Oh my gosh, I'm so happy to be here. When I saw the list of everyone coming, it was like a reunion of like my favorite people, colleagues, friends, mentors, the people that have inspired me along the way. I wish we were in person, and I can't wait till we are. So happy. I'm so happy to see you all. I think I know nearly everyone. But I'm Katie Schneider. I'm a family medicine physician. I work up in Wood River as a hospitalist. I could tell you my whole story about getting into provider well-being, but I think I'll spare you all. And I currently am lucky enough to get to do some physician coaching around well-being, as well as work as assistant medical director for provider well-being at St. Luke's.
All right, very good. All right, Chris Hartung.
Hi, thanks, Steve. Great to see your face again. So I am I'm Dr. Schneider's diet partner. I'm the manager of the Provider Wellbeing Center of Excellence here at St. Luke's, and love working with Dr. Schneider. We've been doing some great things. She's probably surprised to hear me say that, but it's true. It's interesting how I got into provider well-being. I couldn't have told you I would have developed a passion for it 5 years ago when I started at St. Luke's, but I took my leadership background and leadership development and program management and coaching and said, I'm going to give it a shot. And it's a lot of fun. I love it. Thanks for having me.
Very good. Thank you. All right, Michaela Schulte.
Looks like we lined all the St. Luke's people up just
Hey.
properly. Hello, everyone. It's wonderful to see you guys. I'm Michaela Schulte. I am a hospitalist and Chief Medical Officer for the Meridian Eagle Nampa Fruitland area for St. Luke's. And had the opportunity to help build the medical staff out in the new Nampa Hospital, and have been basically as a chief of staff there from the get-go, been involved in well-being. I'm also working through the peer-to-peer program. Have to, had the wonderful opportunity to work with some of you here. Excited to meet some others, and yeah, through the pandemic, I guess we can all, share some of the new learnings that we've had through well-being. Just am incredibly grateful for Chris and Katie, who've been really leading the charge here at St. Luke's dramatically. I'm also excited that that FMRI has such a strong focus on well-being, which in Nampa, where my office tends to be, is really been showing, and that's just been, I think, synergistic to really have that focus. And one of the good things I think that the pandemic brought with it, that we've created more psychological safety and an understanding that well-being is not something that just happens on the side or just because you take a deep breath here and there, but it's something we need to all be actively working on as leaders. So yeah, excited to learn more, and thank you for having me.
Absolutely. Thank you. All right, Molly McCormick.
Hi, I'm Molly McCormick. As Jenny said, I'm one of the faculty members with Family Medicine Residency of Idaho, and got involved in wellness back in residency, and then last year was asked to lead up faculty wellness, and was pretty excited about that. And so I took a course through Stanford, the wellness directors course, and just finished that up about a month ago, or a little bit over a month ago, and was so helpful. I highly recommend it. And so it's just been good. We've been in the beginning stages of figuring out what our wellness curriculum looks like at FMRI and working with NAMPA, and it's just been so fun getting to brainstorm with everybody, and yeah, I'm excited to be here.
Great. All right, Robbie Crouch.
Hey everybody. I do know a lot of you guys too, so it's kind of fun to see familiar faces. I work with India King out in FMRI Nampa, part of the wellness committee there. Both of us got pretty involved on this. I think early on in the pandemic, we didn't have a wellness curriculum, and noticed quickly that it was desperately needed. And so we've worked pretty closely together over the last couple of years on that, kind of balancing right now resident and faculty wellness. I feel like is kind of my role in that committee, which is a tricky role, but it's still a lot of fun, and it's been a good learning experience over the last year and a half.
Great, thank you. All right, Robin Drabelbus.
Hello, everyone. Good evening. Steve, I'm so sorry to hear about your mom. Parents are, I think, our foundation for learning and our sort of start and continuation in life, and what all of that brings. And so I feel for you.
Thank you.
So I'm Robin Drabelbus. Thank you so much for the invitation to be a part of this group. It really is, it feeds my soul to even be talking about this, right, as a medical community. It's so very, very important. So I have been an Idahoan for the past 3 months. I'm moving here
Welcome.
from thank you. Moving here from Oregon, but my initial roots were in Southern California, where I did undergraduate and medical school, and then moved up to Portland, Oregon for my residency in family medicine, and then moved on from there to do full scope family medicine, everything from delivering babies to ICU work for about 15 years. And then my alma mater decided to put a branch campus up in my backyard. And so after 15 years of full scope family medicine, and really caring for patients and walking alongside of them in their journey in their life, but hopefully in that trajectory between disease and health, right? And we don't get to make that decision for them. We get to be the navigator sitting in the passenger seat, helping them through that process. They get to make the decisions. And part of the mantra in my education of my patients, because if we just harken back to the definition, the Latin translation, I should say, of doctor, it's teacher, right? And so we're all teachers, and most of the time we spend teaching our patients. And so I kind of landed in this sort of conversation that was easy for me, which was Robbins' 5 no-brainer rules to health and wellness. And so it's all the normal stuff that we think about: nutrition and hydration and sleep and stress reduction and connection with people and all of that kind of stuff. So fast forward, when I joined this northern reach of my alma mater to Lebanon, Oregon, which is sort of in my backyard, but not really, I leaped over and began my career in academic medicine, and was there until just a couple of months ago when I joined ICOM. But I was not on campus with students for more than a week, I would say, and 2 of them like cornered me in the hallway and said, we have looked at the 4-year-long curriculum, and there's, we stretch it and even consider the biochemistry of vitamin absorption, there's 4 hours total in the entire 4 years of the medical school curriculum that has anything to do with nutrition or lifestyle medicine or the lifestyle determinants of health, right? These 2, like, they've been medical students for a week and they've already figured this out, and I hadn't. I'd been there for just a bit longer than a week, but not much longer. And indeed, I looked at the 4-year-long curriculum and said, you are right, there's 4 hours of curriculum. And so the 3 of us decided to start a lecture series called Nutrition in Medicine, which continues to this day. And from that was born a really wellness culture that we tried to create on campus for the medical students to help them care for themselves while they were learning how to care for others. And that wellness culture had a name to it. It was called MedWell, and it stands for mental health, exercise and diet through work, engagement, and lifelong learning. MedWell, right? And I think all of the people on this in this discussion live that every single day, right? We try to strive for that. And so as I transitioned over to ICOM just a handful of months ago, of course, that can't die within me. It's like part of the fiber of my being. And so I just gravitated towards the people who were interested in that same thing on the ICOM campus. And Steve and his crew came over and met with us just a handful of weeks ago, and it was that allowed for me to be part of this group. So I so very much appreciate the invitation, and I just want to say before I end, hello, Molly. I didn't realize that you were here in Idaho, and we should connect. Thank you.
You bet. That's what this is all about. We connect.
Yeah, welcome.
Great. Okay, Sandy Mudge.
Hello, everyone, and it is such an honor to be here with you guys. I think it's been well established that there's a big group of us from FMRI. I recognized and was one of the residents 7 years ago when we started our wellness committee with almost no support and definitely no money, and have gradually built both those things up, which has been great. And so we were able to, when I became faculty, recruit some of our wonderful residents who participated, and now it's just growing bigger and bigger as we realize the problem is ever growing, or ever more, maybe not ever growing, it was always there, but ever more recognized. So so that's been really fun to watch, and I'm so happy to hear what everybody else is doing so we can get even more ideas.
Very good. And finally, Susan Martin.
Hi, everyone. I am a clinical psychologist at the Family Medicine Residency of Idaho, Boise. Gosh, I do a lot of stuff. I was trying to think what's the best use of my time. I was like, oh, I got to talk to Robin about ICOM because I had a third-year med student just tell me that they only have 2 LCSWs for 192 students. Like there was just like, I was like, ooh, I got to get in Robin's group. Anyway, there are, I think for the PVP, my goal is to help vet highly trained, qualified counselors for the PVP because we've had some doozies that were not good fits. So I feel like that's an area that I still love to work on, just kind of helping, well, used to be helping Ada County Medical Society find good counselors for our residents who are seeking care. But as far as at FMRI, I run the Ballant group. It's co-facilitated with physician, and I do that every month for their R1 year. Within that, we have executive coaching with Katie that's part of that program for Art of Family Medicine. I have Adam Kipp, who's a geriatrician who does our mindfulness. I teach narrative medicine. Like, we are always trying to help residents learn early in their career that this is something they need to take care of. And now more than anything, we're recruiting very wellness minded residents who know it's important and come with great ideas. So it's always super fun. What else can I say? I think that's pretty much it. There's other things I do, but I'm just excited to be here and pick all of your brains about better like advancements that we can like collaborate.
Very good. Thank you all. We lost Ed McEachern from Pacific Source because of internet issues, but we're glad he's here. And we had several others that were going to join us that didn't make it, but we'll get them next time, won't we? So it's good. Yeah, again, just a shout out to Susan, to Katie, to Deb, who are all on the committee that helped get our physician vitality program established in terms of policy and procedures. They were really kind of the part of the core of that team that helped stand that up. And it was out of that we found all this energy. So there's some of the veterans that have been in on this for a long time. But I mean, just if you can go to your grid view, if you're only viewing individual, go to gallery view and look at all the expertise that we have on this issue right here in the Treasure Valley. It's amazing. We have a rich wealth of resources where we can tap, and that's our goal, is that we want to connect you to each other as best we can so that you can continue those relationships outside of us being a connector, and that we can continue to broaden this impact here in the Valley. And so with that, what we're going to do is we're going to open up breakout rooms, and I've tried my best to separate best friends from each other so that you get to meet somebody new, but it's not a perfect gig because you're also good friends with each other already. So we're going to go ahead and open those rooms, and I think we're going to send you all automatically to a room. And there could be problems, but what we want you to do is we want you to start by assigning a note taker and jot a few things down, things that are coming to the surface. And I want you guys to think about getting to know each other a little bit better. Find out what you're doing in terms of work in this space where you're at, whether it's your institution or your personal things. Find out a little bit more about that. Talk about maybe things that aren't working or things that you have questions about or things that you go, hey, tell me a little bit more about that. And then definitely if you have a chance to share stories of meaningful impact where you've seen the focus on physician vitality really impact a colleague or yourself or other people on the team or patients by way of taking good care of physicians. So anything around that, we're going to do that until about 7:30. And so Jennifer, if you'll do that magic thing that you do and send us all to our rooms. Ta-da! Just like that. There's a saying that says, leave people wanting more rather than keeping them too long. So We're going to keep you coming back for this as many times as we can this year. So good. Well, I joined one of the groups, and it was some great discussion and getting to know some other people. And I hope that each of you guys also had a good time with that. What I want to do next, really quickly, well, not really quickly, she can take as long as she wants. I want to highlight just one example, I think, of a great innovation here in the Treasure Valley in Idaho that I think exemplifies how we can learn from each other, how we can try new things out. And so I'm going to call on Katie Schneider, who, as you heard earlier, she's the medical director for the St. Luke's Center of Excellence for Wellbeing. And I want her to talk about the EPIC trigger, since so many of you guys use EPIC, that they put into the pediatric trauma unit. So Katie, would you share a little bit about that and tell us about that, just as, and what is the next steps for that?
Oh my gosh, quite frankly, Michaela or Amy should be sharing this. They have been involved with this from the beginning. This was a wellness committee driven, amazing program that I just am aware of and happen to get to know what's going on. So I'm happy to share, but I would really tag Amy or Michaela to jump in if I'm saying anything wrong, because they were part of the championing of making this happen. But basically, we have multiple sites that have a peer-to-peer program that we've legally realized we can share between all of our sites. And gosh, I mean, was it in 2019, Amy, or 2020 that they kicked off the PEDS pilot?
I would
I
say
want to say it was pre-pandemic, or right around, yeah.
Okay, yeah, so maybe 2019. And so basically, EPIC triggered is a not easily EPIC triggered, a bit of an EPIC trigger, and a lot of mining of data to get any providers associated with a traumatic pediatric event. So, and anybody, again, Amy or Michaela, jump in if I'm saying anything wrong, but any pediatric death, whether there's a trauma, whether any, physical abuse cases to peds, what am I missing, you guys? Any tough pediatric case, I guess I would say. And it triggered all the providers involved. So from ER docs all the way to inpatient providers. It also would trigger to their primary care provider if they had a steady one. And we would set up peer-to-peer providers to call each of those clinicians involved to have a peer-to-peer session. The feedback was, I think, overall really positive from what I've heard. They got to a point, I think, towards the end where if a provider had recurrent cases, they kind of kept sending the same peer-to-peer supporter if they had a good relationship. I think that actually created an even safer dynamic. People got comfortable with each other. It's ended. We are waiting on our final survey data at this point, and they're kicking around doing another pilot in the kind of gyn-onc area, I believe, right, Amy? Or
I'm
Michaela?
I'm not sure about that.
Yeah. So I will say, from an EPIC triggering standpoint, like triggering the thing, it wasn't smooth. People really had to go in. It was, I would say, a time-intensive lift to go back and make sure all the providers were appropriately named and appropriately got peer-to-peer support. That probably was the clunkiest part, but tremendous. I mean, I just can't highlight our wellness committee enough on the work that they've done around this. And then Amy and Michaela jump in.
Yeah, I would just like, one thing I just would like to add is really, it was Kendra Bowman, Dr. Bowman, who had built and led the trauma program, the pediatric trauma program at St. Luke's, who really, I think, championed that. Because obviously there are debriefs after some of these traumatic cases, and St. Luke's is fortunate that we also have a crisis intervention team that often is focused very much towards all the members of the team, but not necessarily including the provider. And I think this was something where, especially the debriefs were often being led by the physicians, and this was a gap. And Dr. Bowman brought this forward to the wellness committee, who then, supported it and combined it with the peer-to-peer program. And I think that's what made it so successful, that everybody was getting some care, but we were now also focusing on the physicians, and it's really normalized it, right? I don't know, Amy, you probably
Yeah.
had several of those conversations, right?
Yeah, absolutely. And it's really interesting. It's really through many departments, and there are people that I've done peer-to-peer for that, of course, I've known just because I've talked to them, but have made connections, which it's been really nice. And there's always a common theme, which is, usually just an absolutely phenomenal physician who just had a difficult case. And it really highlighted for me the emotional toll that, one case can take on somebody, and it's pervasive. And it's such a relief for those people to be able to talk in a protected environment. So I think it's been greatly appreciated by those people. And now it really is, like you said, completely normalized. So some people want to talk, other people are like, I'm good. I already spoke with so-and-so and so-and-so, but that even them reaching out in advance of talking to peer-to-peer, I think is a sign that it's normalized, that it's okay to do that and you should do that. So.
All right, Susan Martin has a question for you all.
Yeah, actually a couple of us were kind of like back channeling direct like messages. And so in Ballant, which a lot of the faculty are familiar with as a supportive kind of group experience where you are really trying to put yourself in the position of the patient or the patient-physician relationship, how does peer-to-peer, like, are there any like goals of the peer-to-peer? Is it like consultative? Is it just really about like presenting the case? Like what is like the systematic like purpose?
I'll just jump in and set the stage just about what peer-to-peer is in general. So peer-to-peer is physicians and APPs, nurse practitioners and PAs who are trained. The woman out of Boston, her name's Jo Shapiro, came and did a Treasure Valley-wide training. So St. Al's and St. Luke's were involved together. Gosh, in 2015, maybe, Amy, I'm going to guess, when we did that. Yeah. And it's protected under our peer-to-peer review. So it means two things. One, it's a confidential space, and two, it's a space that anything you say is protected from a court of law. So if you're a provider who's made a mistake, you can speak about that openly and not have fear that that's going to be harmful to you if this were a case to go to court or something like that. So I see it as the most protected space that you can have a conversation about, in my mind, truly. I mean, I can't think of another place that is as protected as these peer-to-peer supporters. And it is a truly, and Amy and Michaela jump in, and anybody else who's done peer-to-peer, like, I see it as like how are you? How are you doing? Like, that's it. I just want to know how you're doing. And we are here to talk about whatever you need to talk about. But you guys jump in and please elaborate on that.
Yeah, so Susan, one of the things that came out of Jo Shapiro's presentation is that even amongst the physicians, that they would prefer to talk to even a physician who does something similar. So yes, it's great to get counseling, but there is something unique to talking to a person who does what you do, and they can relate to your concerns and issues, maybe in some way that another person, and very often, like even a spouse, the person closest to them can't even relate to them. So we try to connect people that have some similar training, so that they can get that level of support. But that is something that actually was shown through Jo Shapiro's work on peer-to-peer.
It's pretty unstructured, right, Amy? I mean, the structure there is that we just open the door and check in with that person. And we try to make sure that everybody has training and has some experience, but we all made our first call at some point. And then there's some guiding principles, we know how to access additional resources if needed. No records are being kept of the conversation, when and how it occurred. I actually have the habit of checking in again a second time with that person many times, unless they tell me not to. But we also know that, if they're additional, if this leads down a different path, then we can can be the person that can help for people to access resources. It's incredibly powerful connection. And I don't know how it's been for you, Amy, but I just really honestly feel those have been, very gratifying connections with people where I really felt like we humanized that suffering that people are going through in that moment.
Yeah, I agree.
And I'll add that we have an amazing video of Dr. Schulte and Baruch having a peer-to-peer support conversation that we use for our training course. So it's outstanding.
You were great. Schulte. Oh my God.
It is outstanding. The other thing that we've done in the past few months that I think has been a nice opportunity for our providers is when we were in the middle of crisis, we set up a provider hotline where peer-to-peer supporters were on call to take calls so anybody can call in. And we've sunset that and transitioned it to a help desk where people can call in and get access to peer-to-peer support, the Ada County, the physician vitality program, they can call and get directly to free counseling, the Idaho suicide hotlines on there. So we've streamlined our resources to one number that we can just refer any provider to get them exactly where they are. And I was shocked. I mean, I know we have a lot of providers, but when it was a hotline, we had on average a provider call in every other day looking for support. And since we've transitioned it to a help desk, which is interesting, we've actually had in December, we had providers call in, one provider almost every single day looking for support. I think that maybe the anonymity of not getting a voice on the other end maybe encourage people to call in. But we have one spot people can go to access all these resources and they're using it. I mean, I was astounded by the number of people that have felt empowered enough to reach out for help.
Wonderful.
So we have a question from Molly McCormick, who wants to ask some of the details about how that works. Molly, are you there?
So along with Susan, we were having this backside conversation with me and Sandy and Janae of for the smaller organizations, it just doesn't seem feasible to try and get this kind of organizational backing just because of some of the legal, logistics or whatever. So I don't know if you guys have any thoughts on for smaller organizations. Have you guys seen smaller organizations be using peer-to-peer? Is this reasonable, or what direction should we go? I think this would be so helpful for residents.
Chris, tell me if I'm wrong on this, or Michaela or Amy, maybe you guys know, but I thought that anybody that was on med staff at St. Luke's had access. Right. And so since your residents and your faculty are part of med staff, I think you can tap into our peer-to-peer program. And if you have people like faculty or residents that want to get trained, reach out to Chris and I, and we'll loop you into one of our provider training sessions. But yeah, I think you can use ours.
One thing to consider, however, one thing to consider, however, is the peer protection only extends to cases that have occurred at St. Luke's. So it's theoretically. Now, nobody necessarily knows, right? It's completely anonymous. There are no records. But for example, as a peer, I could not necessarily reach out to my colleague at St. Alphonsus. That would technically not be peer protected, but we are not keeping any records of it, so I don't know how it would be discoverable. But just for, so people are aware if something happens in a completely different setting. But generally speaking, yes, anybody who's on staff at St. Luke's should be able to access this.
And I would say the only thing is, if you wanted to do it internally, is it was not huge, but I don't think it was a small lift to get it approved through legal, that it's confidential under our peer-to-peer, right? I mean, you did have to kind of go through that process, which isn't impossible to. Yeah, it's a big lift. Okay, thank you, Amy. Yeah, I mean, right, it is a big lift. Okay, thank you. Yeah, I mean,
it was around 1.5 years, I think.
Yeah, it's not
shocking to get
particularly simple. Okay, thanks. So yeah.
But Molly, I would say this is that very often when people come through peer-to-peer, the details of the case become like the background. It's really about the emotional turmoil that they're dealing with. So they're not obligated or expected to talk about the case specifically so much as how they're dealing with it. And so they don't have to necessarily reveal details of a case. So I'd say they should just use it regardless of where it is. We would just much rather have people feel supported and get the support that they need than not. So I would encourage people to just use us.
Yeah, Molly, you can email me and we can get you all connected with how we need to support you guys. Yeah.
Great discussion, everyone. So this is what we want to do. We want to highlight and spotlight things that are happening. Allow these kind of questions to come back and forth. You know, the question Molly posted is, can ACMS do this? And the problem is, I don't have a med staff. And so I don't have a peer review statute. You know, there actually is an Idaho statute that allows medical societies to operate under peer review if it's set up, but we don't have that. So whether we could have an ACMS wide, I don't know that we could ever get there. It'd be a big lift. And so, you know, and here's the thing is, I want every institution solving kind of the problems that are within their institution when they can, and then we solve problems that really cross all the boundaries when they can. And so if this is something that we could ever look into for a countywide thing, I'd love to do it, get there. First things first, we're going to take PVP statewide through the Idaho Medical Association and also with IAFP this year. That's not a done deal, but we're working on that, and we're beginning to meet about that. And so again, that's a place that we can do. And I just want to kind of segue in, and just for those who haven't been around as long, give them just an idea of the steps. And you ask when this whole thing started, and this is a picture right here of that meeting where Sheila Giffen from St. Al's was meeting with the St. Luke's committee. And I just love the cross-pollination there, talking about peer-to-peer and setting that up. And really you see this timeline that we put together that I haven't even updated since 2019 of all the different steps along the way. In 2018, we had the 3 meetings with Dyke Drummond, Colin West, and Paul Deschamps in our series, followed up by other tragedies, and then you know, Idaho being the #1 burnout state for physician, you know, so you know, there's all these steps along the way, and it's definitely as Colin West pointed out, you know, in his address to us, he said, you know, this is a journey wherever you're at as an institution, whether you're a novice and you have minor impact, or whether you're moving to transformative, you know, it's a journey. And so you just got to know where you're at and be content with, we're all just going to take steps together, and each institution alone is going to do that. And we all want to get to the place where physician well-being influences key operational decisions, but we know that that's a pathway that's going to take some climbing together. This is a picture of the conference that Deb Roman really helped put together along with other community partners. And it was at that Jim Souza stood up and said, okay, we've talked about it. What are we going to do as a community, as a medical community, to actually move the needle on this? And it was out of that we decided to begin to focus on the National Charter on Physician Wellbeing, because it came out published in 2018. And you can see here, this was published in JAMA. Colin West was one of the authors. He's the one that will appear tomorrow. And I'll have Jennifer post in the chat. If you want to watch that, you can register for that at 10 a.m. tomorrow. But basically that there's a framework, that there's societal commitments that need to be made around physician well-being, elevating a trustworthy and supportive culture, advocating for policies that enhance physician well-being. There's organizational commitments, you know, supportive systems, engaged leadership, highly functioning interprofessional teams, and then there's interpersonal commitments. And of course, physician well-being all started at, are you resilient? Are you breathing? Are you meditating? You know, well, those are all good, but you got to move up that chain to those institutional and societal levels. And I think that that's what we're talking about, is we're talking, how do we take each of these commitments, and how do we as a medical community make this is the holy grail. This is our golden goose that we're going after as a medical community, where each of us in our own places are advancing this framework forward, and then bringing examples like the EPIC trigger or like P2P, bring those to light so that others can see examples of that. That's the hope of what this networking is about, is that we are able to share some of those ideas with each other, encourage each other, coach each other, continue to learn, and continue to expand the circle. And I told Deb Roman one time years ago when she started the Action Collaborative, and my initial instinct was, hey, how come ACMS isn't doing this? And then I had to have this, kind of repentant moment where it's like, no, the goal of all this is that everybody everywhere is thinking and doing something about physician well-being. And that will be the big win, is when it's so saturated in the culture of our medical community that ACMS actually gets to step out of the way and work on other things because everybody's doing it and the culture has been transformed. So that's my big dream. That's my big vision, and something that I want to invite you into. And so really my question as we talk about the next 10 minutes is, what are our next steps? What's the best route for bringing other people into this? Who are the next level of leaders that physicians, administrators, whoever, who can be drawn into this? And how do we create a space for not only sharing with those who are interested, but sharing with those who are impacted? I mean, I know a lot of physicians that aren't interested in physician well-being, other than it affects them directly. So how do we let them know all that's going on? Because I really believe that when physicians say, can see that there's actually some movement and progress towards a goal, that alone is an emotional lift. That alone takes the dread and the sense of nothing's ever going to change away when they see actually how much is happening. And I'll say this again, Boise is one of the best positioned communities in the nation because of this kind of interaction of the medical societies that I'm talking to about this. And so we already are light years ahead of others. And it's not a race, but I want to ask that question. How do we continue to share with each other? And I'll just open up the floor. What do you guys foresee as opportunities to continue this dialogue together? Michaela, you have your hand up, so I'll let you go first.
Yeah, thank you. I really honestly feel, first of all, we need to connect more, whether it's ideally in person, once again, or just reaching out to each other, networking otherwise. I think that will be really important for us to move on. But I would love to hear Katie's and Chris's take on some of what we're right now doing at St. Luke's, which I think is something I would love to expand more into the physician community, which is sort of a regeneration based on appreciative inquiry. And whereas teams, right now it's on the leadership level, we have gotten together and just sort of, try to work through some of our experiences in the pandemic based on the foundation of an appreciative inquiry and, reframe this. And I don't know, Chris or Katie, if you've had that opportunity yet to go through some of those debriefs. I found it very powerful. I am privileged to, have Dr. Souza as my direct leader, who looks a lot younger on those pictures. Boy, pandemic cost him a few gray hairs, but that was so powerful and so meaningful, especially as physicians, to connect. And I really feel that if there's an opportunity to get people together in that framework, if that might be one aspect where we could be helpful.
Oh, go ahead, Chris.
I think it's a great idea, Dr. Schulte. I mean, we could definitely share the framework. I mean, and Dr. Snyder, we didn't create it, but we reinforced it and we're part of it. So we could definitely share that with the team and even try it ourselves.
Mm-hmm.
Yeah, I mean, we're really lucky at St. Luke's that not only do they have a focus on provider well-being, but we have a really strong focus on all employee well-being right now. And so much what we've heard as feedback from providers is that we're also worried about all the other healthcare clinicians that we work with, right? It's not just about us, it's about nurses and RTs and PTs and all these other people who are suffering alongside of us in these really tricky cases and scenarios. And so we've been lucky to collaborate with our employee well-being system-wide as we think about kind of, we're calling it regeneration, which I think is beautiful, the sense that we can move forward in a different way that has the potential to be better. And with part of that work, senior leadership kicked off this appreciative inquiry, I would say campaign almost, where every leader is supposed to have it with their teams, which is, I think, a beautiful way to start this. And the goal is a fewfold. One, just to kind of be able to self-reflect of what you've been through. Two, to pull out the positive things. There's some changes that we want to keep, right, that are better. Like we found some really key learnings from having to adapt to the pandemic. So to take that, and then also to be able to look forward in terms of what can we be doing, not just for providers, but system-wide to support everyone. So it's, I think, Michaela, that's what you're speaking to. We've been very lucky to be able to partner on that work. And I think some really cool things are coming. I hope to share it with you. We're just kind of working through the process of getting approval of kind of some of the requests from like multidisciplinary teams that weren't just providers, giving us feedback about what would really impact their well-being.
Katie, do you feel like there within St. Luke's or in the medical community in general, there are some underserved populations of providers, like people that just don't have easy access? Like St. Luke's is great, like what we have, great, but there's a lot of people that are either independents, or I'm not sure what's going on at Al's right now, or the other hospital systems. And I would include the VA, and there's just lots of other clinicians out there.
Yeah, I couldn't agree more. I mean, I think that this group together is what's going to start to make that work more systemic throughout all providers rather than institutionally based, which is key moving forward. I mean, I think that's a great call out, Amy.
Yeah, we actually had I apologize. Guillermo Guzman Trevino was going to be on the call, and Naya Antink, both from St. Al's. Mark McConnell was going to be on the call from the VA. So we have a couple, but we are definitely missing some from Salzer, from Primary Health Medical Group, from Vituity, from the internal medicine residency, psych residency, although Abalash certainly I think is on the faculty there. So yeah, so we're still missing some. Andrew Barron, do you want to comment on that?
Yeah, I just wanted to say over at Terry Riley, my goodness, we could really use something like this. And even just to be able to bring this knowledge back and share this with my group would be wonderful.
Fantastic.
I'm happy to get on a
Medical
conversation
students.
anytime. I'm not saying I'm necessarily the best person to. There's a lot of incredible minds on here who've been doing this work for a long time, but anytime I'm happy to chat with anyone because together we will be better.
Hey, Katie, would this also be useful for medical students?
Presumably. I mean, I hope so. I mean, hope so.
First-hand knowledge. That's okay.
Yeah, I hope. I mean, I'm happy to figure out how we make it useful for them. I think that's the reality, is we have to partner with people where they are. So yeah, I mean, I think we should figure it out.
Yeah.
Because that's so much earlier, and so to me the impact can be like forever.
Exactly. Well, I want to honor everybody's time. I want to go ahead and launch a poll, because what we want to do is look for an April date for gathering, hopefully for dinner. And so if you would like to select, you can choose more than one here. Pull open your calendars right now, or I don't know, you may even have your call schedule memorized. Let us know right now which of these you think are best for you. And we'll take that in consideration and try to get together in person next time. And as we finish, I also want you all just to think about who are those people who you might invite to this from other institutions that aren't represented here, because we really do want to extend this. And what I would hope to do is that maybe we can either bring in a trainer, or we can host a call with a national leader on questions that we might want answers on. I encourage everybody to look at the Coalition for Physician Wellbeing. It's a fantastic resource. Membership is cheap, and you can get to all of the podcasts in the library. I'm biased because I serve on one of the engagement committees and host of the webinar each month. And actually, both Katie and Chris are lined up to speak during this year about the things that have been happening at St. Luke's. And Chris is going to talk about emotional intelligence. So those are already great resources that are already planned out, but we have a great list of resources coming up. Yes, if you're naming names, go ahead and put them into the chat, because that way I can save that and we can look at those later. Anybody else? So any final closing comments before we close out and before everyone gets voted in? It looks like everyone's voted in, so we can go ahead and end that. Any final thoughts? Actually, I'm going to toss it to Deb Roman, because Deb is my go-to person to just send us out with an inspiring thought. She inspires me so much. She's such an encouragement for us in our organization. So Deb, would you just give us some closing words?
Wow.
On the spot.
Kind of put me on the spot there, Steve, right?
Everything that comes out of you is gold.
It was this beautiful saying that said something to the effect of how lucky we are to be here at this time, to be able to do this work together. And I would just offer what we talked about in our group was really the foundation of this work is relationship, and being able to work together, to hear each other, to expand the conversation to as many people in our community as we can, and really work to understand each other and find some common ground and common goals. So I feel like we have a lot of that happening. There, you know, all of you people are working on these kinds of conversations, these kinds of initiatives, which is so inspiring. And I think as long as we can continue to come together, listen to each other, and work together on these issues, that there's tremendous hope for what we can accomplish. So I actually want to just thank all of you for all that you're doing. It is such important work and helping so many people, and very inspiring.
Thank you, Deb.
Very good. Thank you all. Have a good evening. I really appreciate everything that all of you are doing wherever you're at.
Thank you, Steve, for everything you do.
Yes,
Take care,
thank you,
everyone.
Steve, for sure.
We'll see you
Be
next
safe.
time.
Bye, everyone.
Bye.
Bye-bye.